killer. These show how fast this can go wrong. Takes is one flea or infected flea eggs on their clothes they are wearing. Egg fall off or infected flea jumps off. Here we go. Cats, rats, mice. People now at risk to become the carrier, and 90% of infected people will die. There is no cure. No good will come from this move. This shows how arrogant the elite have become. They must be drinking from lead cups.
This risk, right, that you take about bringing someone with Ebola to the United States. What are they doing to prevent anyone else from getting this disease?
Well, there is inherent risk, Aaron, but one of the things they're doing is they're going to rely on a very specialized airplane with very special equipment inside it to try to keep the disease isolated from any healthy people who come nearby. And let's move over here and look at what it would be like inside an aircraft like this. Essentially what you're talking about is the construction of a portable room inside here that would be entirely encased in plastic, sealed off from the outside. There's negative air pressure, meaning that the pressure is a little bit lower here than outside. So if there were any sort of rift, there would be pressure of air flowing in. This is not an airborne disease, so that doesn't really matter, but it is a protocol they follow. Inside, if we get rid of the plastic here, you would tend to have a doctor, a nurse, maybe an epidemiologist, maybe you would have an anesthesiologist, and of course you would have the patient. This gets tricky too. There are 3 layers of protection here. The room, the gear the crews are wearing, and also the patient remains covered over in another layer of plastic. And all care as they monitor his heart rate, his temperature, his respiratory reactions, everything has to be done through all of this. And even if he gets into trouble, even if he starts having cardiac arrest or something like that, or he has the violent vomiting or bleeding that Sanjay is talking about there, it must be treated with gloves reaching through the sides of this, and all the waste has to be collected and kept inside, because that fluid is what can make other people sick, and those 3 layers of protection have to stay in place because, Aaron, in trying to save one person, you can't endanger a whole lot more with a disease as deadly as Ebola.